This is LiveWell Talk on Spinal Cord Injury Clinic. I'm Dr. Dustin Arnold, Chief Medical Officer at Union Point Health, St. Luke's Hospital. Today I'm joined by Dr. Elissa Zakrasek, who leads the St. Luke's Spinal Cord Injury Clinic, the only outpatient clinic of its kind in Iowa. From advanced therapies to helping patients manage everyday challenges, this clinic is redefining what spinal cord injury recovery and management can look like. Dr. Zakrasek will share what inspired her to pursue this work, the services available through the clinic, and what hope looks like for those navigating life after a spinal cord injury. Welcome.
Thanks so much for having me.
Tell us a little bit about your background. I don't think we did a new provider on you when you came to town. It's been about a year, right?
Yep, about a year and a half now.
Yeah,
exactly.
Okay.
Yeah. So
I hear all good things about you.
Great. So I am originally from California, and I ended up moving to Iowa winter of 2022-23. We bought some land in Iowa pre-derecho, unfortunately started building after the derecho. But in any case, so I did my medical school and most of my post sort of graduate training in California in physical medicine and rehabilitation through UC Davis and then Stanford for my residency, fellowship.
I'm a Notre Dame football fan.
Got it. Okay.
I hate Stanford.
Got it. It's okay. So basically, family decision to move to Iowa was a fantastic one. Wanted different quality of life, different pace of life for our kids. Bought some land, doing a mini farm in the midst of, medical career and my husband's sort of fintech career. But so no regrets there. It's been fantastic. Me and PM&R and spinal cord injury is kind of an interesting one. When I went to medical school, I thought I was going to be an oncologist. I've always wanted to take care of a whole person, just how, medicine can affect everything from how we think about ourselves in our life to the actual physical aspects of having a condition or a disease. And I kind of stumbled upon physical medicine rehab. I met a physician who was actually an Iowan at the time, who told me to check out PM&R because I was always an athlete and he thought I might like the physical component of it and sports medicine. And I was one of those lucky medical students who had an aha moment. The very first day of my PM&R rotation at UC Davis Medical School, I was put in a spinal cord injury clinic. And to this day, I can remember the faces of the patients that I saw that day. And there was just something about it right away where I knew that's where I wanted to dedicate my career thereafter. So pursued PM&R residency and then fellowship in spinal cord injury medicine. So spinal cord injury medicine, it's not only just sort of intellectually fascinating, just the way that this little bundle of nerves through our back just controls so much. And, as a spinal cord injury provider, I'm not only taking care of what people see, which is the mobility component of somebody that maybe has to use a wheelchair or an assistive device, but it's so many other things that I love being sort of that subspecialist in this tiny niche field that can understand what else in terms of their bowel, bladder function, their skin, their respiratory function, just everything that comes with having a spinal cord injury. So that's fascinating. The research component is fascinating. And then I just feel that it's my honor and privilege to take care of people that have gone through this major life change, or maybe they were born with a spinal cord injury and they're just navigating a world sort of differently at a different level.
Real quick, are we seeing less of spina bifida with?
It still depends obviously on the type or the part of the world that you're in. But here in Iowa, I don't actually think I only have like 2 patients that have spina bifida, so maybe they haven't found a way to my clinic yet. But overall, with understanding folic acid and that type of thing.
I'm just curious. I mean, that's something that we've always talked about. I can know of 2. They're probably the same 2 patients. So So tell us what is unique. First of all, it's the first of its kind. Prior to your arrival, Dr. Dove, who was a good clinician, he was kind of the default spinal cord guy. But you actually have a clinic. Tell us what's different. What's going on there?
Yeah. When I decided to move to Iowa, everyone thought I was crazy because I left 2 hubs in California, a VA hub site and a primary all spinal cord injury rehab center in San Jose, California. And so coming here to a state essentially that had no spinal cord injury medicine was a little bit scary. I've been thrilled by the openness of St. Luke's and inviting me in and starting something new and different. So here, the nice thing about it is that we had the building blocks already in place. So as a spinal cord injury doctor, I am one member of a team, and you cannot take care of individuals living with neurologic disabilities like spinal cord injury as just a physician. So yes, I bring the expertise of managing all those things I mentioned with bowel, bladder, skin, respiratory, et cetera. But with that, here at St. Luke's, we have fantastic neurorehabilitation therapists. So physical therapists, occupational therapists, we've got great health psychologists, therapists, neuropsychologists, we've got the speech language pathologist, the rec therapist. So we have the inpatient, the outpatient component of all that was already in place. And all of these individuals have been thrilled to collaborate with me to help build and have sort of collaborative clinics. So now we're doing annual evaluations where it's not just me, but the opportunity to meet with me and physical and occupational therapy, wheelchair experts. We have fantastic long-term expertise in managing and sort of prescribing appropriate wheelchairs and seating systems. So that was a fantastic thing that was in place that just needed sort of a way to tie it all together. And then within that, of course, we've got, great resources within the gym. I mean, there's a car there you could practice getting in and out of. We've got FES bikes, all these other components that were already in place. So being able to work together and provide this real wraparound care for these individuals, not just when they're in acute rehab, but then for the rest of their life is really the goal that we have in the clinic.
Yeah, that's the type of diagnosis. I don't know if you know this. I used to do a home ventilator practice, mostly ALS, most of the patients.
Yeah.
That if you don't create a medical home for them, they don't want to sound like a bean counter here. They'll take up a tremendous number of resources that otherwise they wouldn't be taking up if you were just giving them a medical home. So that's what's really awesome about what you're doing. And then wound care, I still see the spina bifida and some of the other spinal cord injuries, motor vehicle accidents usually. But if you don't establish a home for them, they'll take up resources and kind of, be adrift.
Absolutely. Well, and you can't, for most of these conditions that they're dealing with, if you just go to urology or you just go to GI, you're not going to tie it all together. And so that's where I view my role as someone that sees sort of the 30,000 foot view looking down, that if their bowel function is not in line, it's going to affect their risk of UTIs, it's going to affect their spasticity, it's going to affect their pain. And so being able to see that full picture together does require that home model rather than just going to this for this person for that and this person for that. You have to tie it all together.
Now, I've been waiting to ask this question for you. What is the future of spinal cord injuries?
Yeah. So, I think there's a lot of different ways, of course, it could go. Right now, what's most exciting to me in the field of spinal cord injury medicine is the world of sort of neuromodulation. So neuromodulation means probably different things to different people. A lot of it involves electrical stimulation in some form or another. There's a lot of people that have been excited. There's been a lot of hype about stem cells and these other things. And, it's not that isn't going to be part of the future. I think a big part of the future of spinal cord injury medicine is going to be taking different areas of research and bringing them together. It's not going to be one thing. We're going to need to recognize that a chronic spinal cord injury has scar that needs to break down. Plus it has inflammation. Plus it has, bridging that needs to occur. So it won't be one thing. It'll be a combination. But I think what's really most exciting currently in the field of spinal cord injury research is this world of electrical stimulation and neuromodulation. Some of that, basically the way I view it, is this idea that if you, probably with the exception of like a cord transection where, a cord was completely severed in half, if there's any nerve connections that are still there, if we can turn up the volume of those nerve signals by sort of adding some extraneous electrical signaling to that, we can build the strength of those signals, maybe then hit that sort of neurologic threshold for activation of that sensation or strength, and then bring back function. And so that's been a growing area of research for years. And initially a lot of it was implanted, big neurosurgical sort of interventions. And these days there's more transdermal, sort of through the skin electrical stimulation that can be done, including, a device that just got FDA approval this year that may bring patients back some hand sensation or function, which has really not been something I've been able to suggest or offer to individuals with chronic spinal cord injury ever in my career. So I think this, at least for me right now, is what's most exciting.
Yeah. So how somebody has a spinal cord injury, this is going to be a tough question to answer. Prognostically, how much can they recover over time in the early phases? Yeah.
So it totally depends on the spinal cord injury. Okay, and that's what's so hard when I have that conversation with an individual, because no two spinal cord injuries are alike. The easy ones are the hardest, are those like complete cord transections. And then you can say, I'm sorry, there's probably not a lot of recovery you're going to have. But most injuries are incomplete or discomplete, where there's at least some connections that are there, even if we can't see it on an easy exam. And so then, we know most recovery happens within the first 3 to 6 months. We then tell people, often people are plateauing a year to 2 years after injury. I usually tell people that my best crystal ball is them looking back at themselves. So if there's someone that's had an injury for a couple weeks to a month and they look back and they've seen that they've already had some recovery, I usually tell them I would expect that trajectory to probably continue for a while, versus someone who comes several months after injury and they've seen zero changes since the time of their injury. If they're already hitting that plateau, there may still be some little changes that happen, but oftentimes less thereafter. So it's usually kind of looking back at the recovery that they've had, which tells us the most about the injury that occurred.
Interesting.
Yeah.
Yeah. Yes. That is encouraging for the patients who are seeing a little trajectory there. Motor vehicle accidents are a common cause of, or let me rephrase that, traumas. A sudden stop when something else continues to move, causes injury. But what can we do to, other than the seatbelt, of course, and don't get in a wreck, prevent spinal cord injuries? What's some advice you can give people?
Totally. So, obviously most accidents, somebody thought this could never happen to them. And
right.
Nobody, very, very rarely this is an anticipated event. And yes, of course, seatbelts. I mean, I think in the motor vehicle accident, we have to remember that's not just cars, but it's motorcycles, it's ATV accidents, farming vehicles, et cetera. So any kind of safety devices, I mean, they're there for a reason, encouraging people to use them, certainly. Kids in car seats, they're not just a way to sell more things for older kids, but you really want that seatbelt to fall in the correct place on the chest and not be going across the neck of a small person, in terms of how that impact might then hit the body. The big one that I think, people don't always think about that I think is important to mention, especially this time of year as we're going into the summer months, are diving accidents. Exactly. So it's in the top 4 leading cause of traumatic spinal cord injury is diving accidents. Well, recreation accidents, and then amongst those is diving accidents is a really big one. And so when we think about going out in the summer to ponds, creeks, anything where you cannot see the bottom, if you don't know where the bottom is, do not dive into it is a big one. Obviously, similarly to being in a vehicle, you don't want to be impaired in any way if you're going to be swimming or diving. But unfortunately, I've seen many individuals, including old mentors in the field of spinal cord injury, that had diving accidents that led to spinal cord injuries. And unfortunately, these are often in the neck based on the head impact that happens at the bottom. Yeah. And so, being aware, making sure you're never diving into something where you can't see the bottom. If you're ever questioning whether or not you should dive, don't. If you think a shallow dive is the only thing that's safe, just don't dive. And, being aware, sometimes the ground can slip beneath you as you're diving. And so even if you think, I've got this nice shallow dive, I'll be fine. It's never worth that risk, I think is the main message. Yeah, I can think of some famous people that have had that occur to them. Mm-hmm. How do individuals get a hold of you and referred to the clinic? Totally, yeah. So, at this point, I believe a lot can get through self-referral, if they reach out to the clinic. And, I'm happy to see anyone who has any type of spinal cord injury or disease. So that includes not only traumatic injuries, but, multiple sclerosis. A lot of individuals with multiple sclerosis have significant spinal cord impact from that, or hereditary spastic paraplegia. There's some other conditions, spina bifida, as you mentioned. So reaching out to the clinic directly, you can certainly go through primary care doctors or other providers and get a referral to the PM&R clinic and just say you want to see the Spinal Cord Injury Clinic or Dr. Z is fine, and you'll make your way to my clinic. Happy to see anyone who feels that my services or again my team-based model of spinal cord injury care. Happy to work with you.
Fantastic. Well, I was really prepared not to like you because you went to Stanford and I'm a Notre Dame fan, but you're actually really nice.
Well,
I'm glad you're here.
Thank you so much.
Dr. Zakrasek, thank you for sharing your expertise with us today. For anyone impacted by a spinal cord or spinal cord disease, we hope today's conversation offered some knowledge, encouragement, and a reminder that the support is right here in Eastern Iowa. If you'd like to learn more or schedule a visit with Dr. Zakrasek, talk to your provider or call the clinic directly at 319-369-7331. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.